My name is Greg Runke. I am an assistant professor in the section of hospital medicine in the University of Chicago's Department of Medicine. David Dukas and I have written a paper entitled Trust in Residents and Board Examinations, When Sharing Crosses the Boundary. David is the William Ray Moore Endowed Chair of Family Medicine and Medical Humanism in the Department of Family and Geriatric Medicine at the University of Louisville. We wrote this in response to CNN reports in 2012 regarding the use of reproduced board examination questions among radiology and dermatology residents who refer to these questions as recalls and airplane notes, respectively. These questions were then shared with future trainees to improve test performance and perhaps reduce study burden. Unethical behavior threatens the profession of medicine and the public trust critical to its preservation. To highlight this, we begin by discussing the ethical foundations of professionalism. Although reproduction of the questions is clearly a violation of examination copyright policies, some physicians interviewed by CNN did not believe that using the reproduced questions constituted cheating. They rationalized recall use as simply a study guide, whereby test questions are used to affirm understanding of the underlying knowledge rather than rote memorization of answers. Given this opinion, we discussed the use of examination experience to create study guides throughout the physician training process, including materials produced by the American College of Physicians. The difference between the use of questions reproduced verbatim and a focused study guide lies in the detail and specificity of information transmitted. We then discuss the drivers of dishonest behavior and review the literature on unethical behavior among medical students, which is surprisingly common. Estimates range widely from 5 to 88%. Of medical students surveyed, 59% believe that cheating is impossible to eliminate because of its pervasiveness. Difficult exam content unnecessary for clinical care, a desire to assist friends, and peer behavior are important factors. In response to the CNN reports, the American Boards of Radiology and Medical Specialties have condemned both the creation and use of recalls. However, given the extensive use of examination experience to focus learning throughout the physician training process, we urge that guidelines be established regarding the nature of information that may be ethically disclosed. We conclude with a discussion of how unethical behavior may best be curtailed by creating an environment in which academic and professional dishonesty is unacceptable. Peer behavior and other contextual factors have a much stronger impact on ethical decisions than individual factors and the threat of severe punishments. The literature suggests that this can best be achieved by embedding academic honesty into institutional cultures. Cheating will be minimized by ensuring that exam content is highly relevant for the clinical practice that will be endorsed by graduation or certification. Ultimately, the sanctity of our profession and the faith that patients place in us as physicians demands the highest moral standards.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.